Hi, I'm Pauline Marquardt. I'm the Director of Strategic Innovations at the Centre for Excellence in Child and Family Welfare. I lead the Lived Experience Design project. I've been doing this project now for 2 years. So the Lived Experience Design project brings together lived experience birth parents, predominantly females, women, mothers from across Victoria. I've been working with the parents to build capability in advocacy, to build their capability in their storytelling, and to also build their capability in how to engage with government from a strength-based process. I'm really honoured and I'm really privileged to introduce to you our parent designers that have been working with the centre. We've been able to retain their engagement and we've been able to build some really strong professional relationships with them.
Hi, I'm Lex. I was fortunate enough to be aware of my involvement with child protection prior to it happening. My family suffered severe mental health, a lot of disorders and that, so I had quite a large care team around me.
Hi, my name is Tammy, and my mental health through this, I quite affected a lot in regards to when he was taken from me and I did not know where to turn or what to do, and I became very depressed.
Being a First Nation parent and living with a disability, it makes it very difficult to find or act differently to what we know of.
Hi everyone, my name's Maxie. I'm a single mum with a disability. I also suffer from some mental health, which the two clash together in hard times. I have a great support team and I'm here today to help the system by lived experience and change policy and procedures.
Working with these parents over the last 2.5 years, what has become really paramount is these women, these parents, these birth mothers are very focused on their lived experience, not just from the negative and the impacts it's had on them and their families and their broader communities, but also how to take their learnings and take them into places and spaces where they can get to share those experiences from a strength base. In that they don't want other families, mothers, fathers, communities to experience the same types of ways of working, the same types of program delivery, the same types of service delivery that has impacted them in a negative way.
Child protection first came involved with me when I had a mental breakdown. It was a bipolar manic episode. I was in hospital for 6 weeks. The doctors were telling me that I just needed to get better well enough to go into the mother-baby unit with my daughter. But when I went into the first meeting with child protection, there were 2 workers and a doctor. They weren't interested in anything that I had to say.
Eventually there was a little bit of acknowledgement of me having a disability, but in actual fact that worked against me because they actually said that this parent cannot parent her child. She's not safe to do so.
Well, the thing is, the minute any parent has their children taken away, that is going to worsen their mental health.
The experience is very traumatizing at first. It's very scary. It has an impact on your everyday life. You know, child protection needs to remember we are living with a disability, we are good parents, and we can excel.
So here at the centre, we believe that hearing from parents, hearing from lived experience generally is really, really important for system reform, service delivery and ways of working. We believe that hearing from lived experience and profiling their voices is really critical and it's paramount to breaking down the systems of stigma and the ways of working where people create and make assumptions about families who are experiencing vulnerabilities.
Compassion and respect go a long way when you're dealing with a parent who's struggling with mental health.
When giving information, it's good to be given information in accessible formats.
It's all about the way you present yourself.
We don't understand facial expressions or tone.
We're made to believe that we're not a good enough parent, we're not worthy, of having a happy, normal life.
To explain what their role is, what they're here to do.
Parents with a disability learn better when they're shown how to do things and then given the opportunity to practice what they've been shown.
It's essential to tread lightly, especially in situations where child removal might be considered.
Reading case notes, understanding the client and the child, being prepared, being understanding. If there is somebody with a disability, research the disability, get a general practitioner involved.
Practice what you preach, treat us like humans, see us for the loving, supporting parents that we actually are.
So here at the centre, we've spent the last 2 months focusing on parents living with mental health and parents living with a disability. You'll hear more about our parents and their experiences. They have generously shared with us and with you what works for them, what doesn't work for them, what might influence your ways of working and how to engage with them, how to think about the services that you design and the services that you deliver, so that it can bring the best out in them, it can bring the best outcomes for their families, and most importantly, build a really positive relationship between you, the practitioner, and them, who is the service user.
25 years later, I had another child and she wasn't removed. She stayed in my care. And I think some of the things that were different were I'd actually engaged with child protection during the pregnancy. I'd created a little team of people around me who supported me throughout the whole thing and still do support me now.
I've grown stronger in regards to I'm proud of me now. I've got a voice. I never did think that I would ever be able to discuss this.
It's really, really important from a practitioner level to adapt your communication, to adapt your ways of working, to meet the needs of the individual that's in front of you and their families. So thanks for taking the time to watch and to listen to our parent designers on the topic of mental health and disability.